Dr. Prashant Suryavanshi in the health meeting chat today stated that the screening and surveillance regarding monkeypox has already begun at the Goa International Airport. If there's any suspect, samples will be sent to Pune lab. He said, there's no suspect of monkeypox in Goa till now, but two beds are allotted to each health centers. If at all there is rise in monkeypox, the availability of beds will be increased.
I am the state surveillance officer and IDSP and even the state epidemiologist. Why we have gathered today over here is just to tell you or inform you about monkeypox disease. Okay, and we all are aware that WHO has already declared monkeypox as a public health emergency of international concern, and earlier state of our country India was not having cases, but recently you all also must be aware that in Kerala state we have already got 3 cases confirmed, and Delhi also we have got 1 case confirmed. So in our country we have almost now we have 4 confirmed cases of monkeypox. Okay, so we thought like we will just brief the people, the general public, about little bit about monkeypox, make them aware what it is, what has to be done, and what measures government has taken, what our health department has done, and what we are going to do in future to control monkeypox, so that we are ready, we are geared up to tackle monkeypox in the state of Goa. So as far as monkeypox is concerned, you all know, we know that it's a viral disease. Okay, it's a viral disease. We all have seen COVID, how COVID has actually affected us, what it has done to us, and like how we had gone to control it. Okay, how we have make it or keep the cases down. As far as monkeypox is concerned, now it's a viral disease. It's caused by the virus called as monkeypox virus, and the cases started rising globally in the month of April. It started rising and it has gone to huge number now. It has been spread to almost 77 countries all over the world globally, and more than 16,000 cases have been detected globally. Okay, and India has seen 4 cases. As far as deaths are concerned, there are around 12 deaths, which all are in the African country. Nowhere else death has happened. Okay, so coming to monkeypox, सगळ्यात इम्पॉर्टंट गोष्ट सांगपाची म्हणल्यार भिवपाची गरज सद्या तो इतलो डेंजरस वायरस ना. ओके, इतलो डेंजरस वायरस ना. केसेस मेळटा, जे पण काही केसेस आमकां मेळ्ळा ऑल ओवर द वर्ल्ड, इट इज नॉट अ व्हेरी सिवियर डिजीज. डेथ्स फक्त 12 जाला, ते सुद्धा आफ्रिकन कंट्रीन जाला, अँड बाकी खंयच डेथ्स जावंक ना. आतां आमी आतां सर्विलन्स आतां जी चालू आसा ती ऑलरेडी चालू आसा. ओके, सो मंकीपॉक्स डिजीज कितें जाता इज लायक इट स्टार्ट्स विथ रॅश. इट स्टार्ट्स विथ रॅश. ओके, बारीक रॅश जाता पाम्साचेर, फेसाचेर, सोलाचेर. ओके, युजली बॉडीचेर रॅश मातशी कमी आसता. ओके, आनी फिवर येता. ओके, सगळ्याच पेशंटाक फिवर येतलो असो ना, पण फिवर सुद्धा येता. ओके, मायल्ड फिवर इज देर, बॉडी रॅश इज देर. देर इज समथींग कॉल्ड एज लिम्फ नोड एनलार्जमेंट. आमची जी बारीक बारीक गुटां आसता ती एनलार्ज जाता. ओके, पेशंटाक एकदम सिवियर विकनेस येवंक शकता. लेथार्जी म्हणटा आमी ताका, सिवियर विकनेस येवंक शकता. बॉडी एक जाता, मायल्जिया जाता. ही जी गोष्टी आसा ही जावंक शकता. ओके, सो हो जो हेचो इन्क्युबेशन पिरियड आमी जे म्हणटा, ओके, इट इज ऑलमोस्ट अराउंड 3 to 7 days, बट मॅक्झिमम इट कॅन गो अप टू 21 days ऑल्सो. ओके, पण ऑन एन एवरेज यू कॅन कन्सिडर इट ॲज अ 7 days इन्क्युबेशन पिरियड हो जो आसा. ओके, मॅक्झिमम इट कॅन गो अप टू 21 days. सो दॅट इज वाय आमी जो सर्विलन्स केला तो सपोज इन्फेक्टेड कंट्रींतल्यान कोणीय ट्रॅव्हलर येयलो, ओके, फ्रॉम दीस अँड हू इज युजली 21 days बॅक पर्यंत जर कोण येयला आसा आनी इफ ही कंप्लेन्स ऑफ सम फिवर, सम रॅश, सम बॉडी एक, सम मायल्जिया, ओके, अँड लिम्फ नोड एनलार्जमेंट, सो आमी ताका एक सस्पेक्ट घेता. ओके, सो आमी कितें म्हणटा, एक सस्पेक्ट, ओके, आनी प्रॉबेबल केस आनी कन्फर्म्ड केस. सो एनी सस्पेक्ट जर कोण आसा, सद्या आमी आमच्या ऑलरेडी आमी पूर्ण आमच्या सेंटराक डायरेक्शन्स दिल्ले आसा. We have already told everyone, and that order has already been issued, that our both district hospital, our both sub district hospital, our all the CHCs and सब डिस्ट्रिक्ट हॉस्पिटल चिकालीम आनी PHC कासावली ऑलरेडी तांकां सगळ्यांक आमी 2-2 बेड आयडेंटिफाय करून दवरपाक सांगला. आमकां जर खंयच्यानी सस्पेक्ट केस मेळ्ळे, इफ इट इज ट्रॅव्हलर फ्रॉम इंटरनॅशनल ट्रॅव्हलर, फ्रॉम डोमेस्टीक ट्रॅव्हलर, इफ somebody has travelled, somebody just informs that this is a suspect case, that particular patient will be admitted in this particular hospitals as a suspect case. आणि मागीर थंयच्यान आमी तेंचे सॅम्पल धाडटले NIV पुणे खातीर. ओके, आनी सॅम्पल्स कितें आसता, एक थ्रोट स्वॅब आसता, एक ते सिरम सॅम्पल जो ब्लड सॅम्पल आमी म्हणटा, आनी एक सपोज जर तांकां रॅश आसा किंवा लिजन्स आसा, त्या लिजनाची आमी सॅम्पल धाडटले टू NIV पुणे. एंड द मुमेंट इट वील कम रिपोर्ट, देन वी वील डू फर्दर हे. समज जर नेगेटिव्ह आसा तर घरा वतलो, आनी जर पॉझिटिव्ह आसा देन वी वील सी हाऊ मच टायम द पेशंट हॅज टू बी केप्ट अँड ऑल. एज फार एज ट्रिटमेंट इज कन्सर्न, एक्चुली ताका असो सिम्टमॅटीक ट्रिटमेंट आसा. ओके, केन्ना केन्ना चड पेशंटाक खूपच जाल्ले आनी इम्युनो कॉम्प्रोमायज पेशंट जर आसा तर तांकां एंटीवायरल दिवची पडटा. ओके, अदरवायज इट इज फॉर फिवर वी आर गिवींग सिम्टमॅटीक एंटीपायरेटिक्स दिता, एंड फॉर द लिजन्स ऑल्सो सुदींग एजंट कॅलामायन एंड ऑल. मोस्टली कितें जाता, तांकां डिहायड्रेशन जावंक शकता, सो तेजो पेशंटाचो हायड्रेशन बरो दवरूंक जाय. ओके, दॅट इज मोस्ट इम्पॉर्टंट, हायड्रेशन बरो दवरूंक जाय. ओके, दीस इज ऑल रिलेटेड टू वॉट monkeypox disease is there and how we are going to handle and what are our strategies. ओके, लोकांच्या खातीर, कम्युनिटी खातीर सांगपा खातीर म्हणल्यार जे आमी कोविडाक लागून करताले, ओके, तो सगळो तुमी लायक हँड वॉशिंग टेक्निक्स हे सगळे करूंकूच जाय युजली. आनी चडांत चड केस जे आसा आतां तेजो ट्रान्समिशन रूट्स जे आसा, ओके, एक म्हणल्यार ते आतां सद्या इन्व्हेस्टिगेशनान आढळून आयला इज अबाउट सेक्शुअल रूट ट्रान्समिशन. सो इट कॅन ट्रान्समीट थ्रू सेक्शुअल रूट, दॅट इज वन थिंग. अ प्रोलॉंगड कॉन्टॅक्ट फेस टू फेस कॉन्टॅक्ट जर आसा, ओके, सपोज आतां हेल्थ केअर वर्कराचे जर आमी घेता, तर इफ हेल्थ केअर इज वेअरिंग अ प्रॉपर PPE, हेल्थ केअर वर्कर एक पेशंट आयलो आनी प्रॉपर PPE घेवन ताका जर हँडल करता, देन द चान्सेस आर व्हेरी लेस. If a prolonged contact is there where there is no PPE, then maybe the chances are there of transmitting. Another is like skin to skin, जेन्ना लिजनाचे ताका जर लिजन आसा, ताका रॅश बारीक आसा पॅप्यूल, आनी त्याची जर हे जर लिजन टू लिजन कॉन्टॅक्ट जर जाले, स्किन टू स्किन कॉन्टॅक्ट, देन ऑल्सो चान्सेस आर देर. ओके, सो फॉर द पब्लीक सांगपाक शकता की सद्या तुमी इतलो असो भयाचो काय भिवपाची गरज ना, भयाचो काय प्रश्न ना. सो बिकॉज द ट्रान्समिशन एज आय हॅव टोल्ड इज थ्रू सेक्शुअल रूट, वॉट एवर मोर केसेस विच दे हॅव बीन सीन आर थ्रू द सेक्शुअल रूट इज देर. इवन फेस टू फेस प्रोलॉंग फेस टू फेस कॉन्टॅक्ट इज इफ इट इज देर, ऑर स्किन टू स्किन कॉन्टॅक्ट जर आसा. ओके, सो जी 4 केसेस इंडियान मेळ्ळे आसा, दोज ऑल आर आयसोलेटेड, तेंचे कॉन्टॅक्ट्स आर बीन ट्रेस्ड, एवरीथींग हॅज बीन डन. सिमिलरली if we get a suspect in Goa also, same isolation will be done. all तेचो आमी टेस्टिंग धाडटले, तेची कॉन्टॅक्ट ट्रेसिंग करतले, आनी वी वील फायंड आउट एंड वी वील सी दॅट वी आर geared up. State of Goa is geared up for if at all we get a suspect case, we are ready to fight it out, and we will see that there is no outbreak of monkeypox in the state of Goa. That is what I have told. And a routine जे आता हांव सांगता तुमकां, usually I always tell about what precautions we have to take. Again, I would say like our COVID cases also have not gone, it is stable around 100, below 100 or something, it is stable. So whenever you go in large gatherings or something, so see that you use COVID appropriate behaviors. And whenever you go to some hospital for checkups or something, please do wear mask. In so gatherings, big gatherings, do wear mask. If somebody from an individual level, if somebody is having cough, if somebody individual level, if somebody is having cough, little cough here and there, then he should wear mask. Okay, so कारण त्याच्या कडल्यान दुसऱ्या मनशाक कितें वायरस ट्रान्समीट जावपाक जायना म्हणून. Okay, so these all things. Hand washing, again, as far as possible, whenever you go anywhere, try to hand wash. Okay, as far as possible, don't touch with your bare hand to your nose or mouth, okay, eyes. As far as possible, don't do these things. Whenever you have to do this, then kindly hand wash that thing. Again, same दो आमी जे हँड वॉशिंग टेक्निक्स इन्फेक्शन कंट्रोल मेजर्स जे आमी कोविड टायमाक करताले सो दीज ऑल शूड बी फॉलोड okay so these are the things which I wanted to tell as a state epidemiologist to the state of Goa so that we are geared up and we are prepared for monkeypox. Now international monitoring is going on as far as Goa is concerned. Our airport has been informed, they also have got guidelines from government of India. We have also sent them what are the guidelines, how it has to be screened. So for international travelers already screening has started and they are doing the screening at the international airport. त्यांचे क्वेश्चनर्स आसा त्यांची जी फ्रॉम दे आस्क इफ एनी सिम्पटम्स आर देर and they have been examined right now. As of now we have not got any suspect, okay, and the moment we have also informed them like if they get any suspect then these are the centers where they can send the patient and patient will be isolated there and from there samples will be sent to NIV Pune.
What about the port?
Yeah, we have already informed.
Medicine for monkeypox?
That is what I told, medicine for monkeypox because it's an antiviral treatment. So sometimes in few cases antivirals are needed, very few cases for immunocompromised patients and all. So otherwise it is all symptomatic treatment.
Doctor, तुम्ही 2 beds म्हणल्या नो every hospital.
As of now it is 2 beds. If we get many cases then that will be an increase.
डिस्ट्रिक्ट आणि सब डिस्ट्रिक्ट हॉस्पिटल आहे त्यांना किती आहे?
हां सगळीकडे आम्ही 2-2 दवरला. बोथ डिस्ट्रिक्ट हॉस्पिटल 2-2 बेड, बोथ डिस्ट्रिक्ट हॉस्पिटल सब डिस्ट्रिक्ट हॉस्पिटल 2-2 बेड, एव्हरी कम्युनिटी हेल्थ सेंटर 2-2 बेड आणि PHC कासावलीन दवरला 2 बेड and cottage.
Doctor, is it possible that the monkeypox virus can be detected in those who do not have any travel history?
So right now what they are saying is like the Delhi case, that is what news we are getting, that he is claiming that he is not having any travel history. That is what the Delhi case is saying. So we have to investigate in that.
Doctor, as far as COVID is concerned, can you say the cases have plateaued down?
Yeah, if you see yesterday also it was below 100 and the cases are around in and out around 100 only. So looks like the cases have plateaued. All over India also the cases are not increasing how it was increasing very steeply. So cases looks like it has plateaued around, at least Goa is concerned, it is around 100 only. It has not gone up. Maybe today we'll see what are the cases.
So the precaution for monkeypox is as same as COVID.
Precautions are the same. आमकां जे आसा हँड वॉशिंग टेक्नीक सगळे आमकां बिकॉज इट्स अ वायरस, बिकॉज खंयच्यान येतले कशें येतले आमकां खबर ना. सो इफ समबडी इज हॅविंग कफ then he has to take precautions as like COVID virus only.
You said it is skin to skin. Is it possible if I touch an infected person clothes?
That is what if the infected person is having lesions, if he is having that lesions, monkeypox lesions are there. So what happens? You must have seen in chickenpox how they are water filled. So they also are sometimes that type only. Okay, so that fluid if it touches, then maybe the chances are there. Thank you.